All right, welcome everyone to the Health Sciences Open House. We are thrilled that you have set aside time to learn about what MC has to offer, and it is a lot. We have a lot to cover, and we will do our best in the next hour. So let's go over a few housekeeping items. We are joined by faculty, students, and alumni who will be sharing about community health, nursing, and physical therapy during the first half hour of our time. The second half of our time, we will host a Q&A on nursing, or you may choose a breakout session to attend, as you see on the spotlighted agenda. Those breakout Zooms with the QR code are not active yet, so stay around until we let you know that they are open. But before I introduce our panelists, I would love to know a little bit about you. So let us know. We have a poll, and there's 2 questions, very quick. Just if you can take 15 seconds to answer that, it would be very helpful. Go ahead. All right, so that just kind of lets us know a little bit about who's here and what are the areas you're interested in. So fantastic. I think we can share the poll results. I believe we can do that. Yep. All right. So thank you very much for participating. We have a good number of you who are not yet enrolled in MC and some of you who are students already. So fantastic. I myself was a student here once, and I am thrilled to be here just moderating this session. So let me just kind of go over a couple of things. If you have any questions for our panelists, you can use the Q&A button that you see at the bottom of your Zoom screen. But if you need help with anything, the chat will be an appropriate place for that. Now, as I mentioned before, our Zoom will begin covering community health, nursing, and physical therapy. So why don't we get started? We are gonna, let me just let you know who's here and who are our panelists. Dr. Agunsende is a clinician for 24 years and clinical coordinator and professor at Montgomery College. We also have Michelle Agostini. In the nursing program, she interacts closely with first and second semester students. You'll get to hear a lot from Michelle if you decide to stay for the Q&A session instead of going to a breakout room. We have Dr. Joanna Kilby, who is our community health program coordinator with a passion for working with healthcare organizations for the good of the community. Welcome, Dr. Kilby. And we also have a number of students. Grace Checken, who's here. She's a nursing student right now in the Dean's List as well. Thanks for joining us. We have Daniela Spence. She is an early college student and was already offered a job with MedStar Washington Hospital Center. Congratulations. We also have Kendall Johnson. He's a second-year physical therapy assistant student. And yeah, thank you for joining us. It sounds like you're excited to see patients recover and achieve their goals, and we are thrilled to have you here. And Johannes Girma, I don't think he's here yet, but hopefully he will join us shortly. I also want to point out we have Jimmy Wen, who is ready to help with any question regarding enrollment and joining Montgomery College. And also Maureen Morawski, who is our health sciences counselor. So if you have any questions for them, they are available. All right. Now I'd like to give the floor to Professor Kemi Okunsende. Go ahead and let us know about physical therapy.
Hi, good evening. I'm Dr. Konsende. I'm a full-time faculty with a physical therapist assistant program. So who is a physical therapist assistant? These are people who help in the treatment of individuals of all ages, all the way from newborn to the end of life. Many patients have injuries, disabilities, or other conditions that need treatments. And the beautiful thing about physical therapist assistants is they have a profound effect on people's lives. So there are three ways of entry into the profession. One is through physical therapy, the other is physical therapist assistant, and then the third is working as an aide or a volunteer at any of the healthcare centers available. The physical therapists need to have a doctorate in order to practice, whereas our physical therapist assistant graduate with an associate in applied sciences. So this is the program that we have here at MC. All right. So as far as the prerequisites go for physical therapists, you need to have a bachelor's degree to apply to their program, whereas with our physical therapist assistant, we actually have students from our early college program from Montgomery County Public School, or we have students who also have a bachelor's. And as far as the admission goes, with a physical therapist, you usually need to do a GRE, GP and volunteer and experiences count, whereas with our program, you do not need to volunteer, but we recommend it to help. You adjust to the program, and most of our candidates have a TEAS test, which they take, or they do the SAT, ACT if they graduated from high school. And as far as the responsibilities go, like I said, the physical therapist assistant works closely with the physical therapist, and as a team, the whole plan is to improve patient outcomes by having people get back to living healthy lives. And when we're talking about the pay scale, the average pay for a physical therapist in this in Montgomery College, in Montgomery County, sorry, is somewhere around $90,000, whereas for a physical therapist assistant is $60,000. And as far as the education goes, the physical therapists usually are in school for 3 years, whereas our physical therapist assistant program is 2 years. And we usually admit our cohort usually in the fall. Usually, a lot of times they might take some classes in the summer, but officially the classes start in the fall. We have some general education requirements for our students, basic biology, English, and math. And when we enroll into our program, we do our foundational courses. We have patient skills courses. We have kinesiology, therapeutic procedures, modality, and neuro. And the vast majority of our students have about 75% didactic work and 25% in the clinic. So the way our courses are actually planned out is we have lectures and we have labs, so that a lot of the skills you learn during the classroom can actually be put in the lab setting. So it's very hands-on. And usually for our second-year students, for the first semester in the fall, they have a 7-year practical where you go out to a clinical site. It could be outpatient, it could be hospital, it could be rehab, and you work closely with a clinical instructor to start building on some of the skills you've learned in class, to start building up your proficiency and start taking care of patients. And usually in your second year, in the spring semester, we have our last clinical, which is 8 weeks right before graduation. So same thing, our students are out in the clinic working with patients and eventually building up their own patient load, becoming more independent because of the strong foundation they get from our program. So it's very it's a fun opportunity for you to actually put your hands on what you've learned in class. And when it comes to our internships, we have a lot of clinical partners in this area. We have the big names in healthcare, private private care and hospital care, where a lot of our students who go out for the clinical practicals, by the second semester, they already have job opportunities lined up for them because this is a great pathway from, starting in a program to ending and also getting employment. So the career outlook for PTA is actually very high. It's one of the highest growing fields per the BLS statistics site. And so my question is this: if you like working with patients, if you like seeing people live healthy lives, if you want to be involved in improving health and wellness in your community, then the physical therapist assistant program is definitely for you. If you have any questions, please join us in our breakout rooms. We'll be more than happy to answer any questions you might have. Thank you very much for your time.
Thank you, Dr. Day. Let's talk a little bit about community health with Dr. Joanna Kilby. Go right ahead.
Hello, everyone. I'm just going to share a little gem of a health program in our that's called community health that a lot of students don't know about. So what is community health? A lot of students will ask me that. If you think about the jobs that we would do as a community health graduate, think about public health where we're concerned about the health of communities, mix a little bit of social work in and maybe a little bit of nursing. And that's really what a lot of the positions look like. Many of our students work in either nonprofits, hospitals, clinics, even government work. We see this as a feet on the ground kind of profession, where maybe I'm concerned about the welfare of different populations in my community, and I actually get to get in there and work hands-on with them instead of sitting in the office where some of the other professions like public health might be. So what does our program focus on? We know in the state of Maryland and nationwide, there's not enough healthcare workers, especially at the entry level. So our goal is to position our students for those open opportunities. We want to make them as marketable as possible, and we have a number of organizations that are ready to hire our graduates as soon as they finish the program. The nice thing about the community health program is you can have the choice to graduate with your AA degree and the certificate that we've included in our program and get out and work, or you can go on to the University of Maryland College Park and finish your degree. About 60% of our students right now are getting out into the workplace and deciding they just want to get their AA degree with the associated certificate and get out and begin to work. So what does the salary look like for those students? We're looking at the mid 50s. It's really anywhere from 40 to 60, what some of our graduates have seen. And what our program looks like is the students in our pathway graduate either on time or early. We have a high success rate with getting our students through the program and getting their degree with their certificate. We're also really proud in our program because we think we're the only community college in the state of Maryland who has actually incorporated the new industry standard certificate, the community health worker certificate, into our program. So a student who comes through our program gets their AA degree, they get this Maryland state certificate that allows them to jump right into the workforce. And there's a high demand in the state of Maryland for community healthcare workers right now. So they're finding that getting their positions are pretty easy once they graduate. And what does our curriculum look like? So if you look at our curriculum that's posted there, you can see why the students are very successful. They have to take one math class, which is a statistics class. They'll take 3 biologies, 2 of which are anatomy and physiology. And then almost everything else that the students take are health electives that are real world related. There's some psychology, there's some theories, there's some hands-on practical courses that teach the students how to relate to the healthcare profession today. We end with a global health capstone, so you get a global picture of what health looks like, and we have a clinical practicum, so you can get some hands-on experience before you get out to the workforce. So who is a good candidate for a community health program? If you want to get your AA degree and get out into the workforce and make a livable salary, great profession for you. If you love healthcare, but you really don't know where you fit and nothing else seems right, and you want those options to work at either a hospital or a clinic or a nonprofit or a government, community health gives you that degree and that platform so that you can jump into any of those directions. If you have any other interest in this, I'll be jumping into the PE physical education breakout room, and you can go ahead and ask me any questions you have about our program. Love to see you there.
Thank you so much. And now we're going to go into nursing. So, Professor Agostini, go right ahead.
Hello, everybody. Good evening. So nursing the heart and hands of healthcare, right? So just take a look at what we have to offer. And I'm going to take you to the first slide where I actually put all the websites. So you actually can see where to go to if there's something I did not say that you wanted to know more about. So let's take a look first. So since the nursing program is part of Montgomery College, your first step is applying to the college and getting accepted. If this is something new to you, there are counselors that can help you on this pathway. Right. The other thing you're going to do then once you get into the college is take what we call your prerequisites. These are the courses that qualify you to get into the nursing program, but you got to maintain a 2.5 GPA. That's our requirements because when you graduate, they will be looking at your GPA. I know it sounds crazy, but our hospitals actually do that, right? So there's also an admission website there for you that tells you what the requirements are. There are 2 application deadlines I want you to be aware of, right? To get into the fall, it's April 1st, and the application deadline for spring is August 1st. So just a little knowledge, and we can talk more if you have any questions about that when we get into the breakout room. Let's talk about, okay, so I know exactly what I need to do. How does it progress out? So this is a 2-year program and it's divided in 4 semesters, and you will be taking different courses along the 4 semesters. Because we are approved by the Maryland Board of Nursing, this means that once you finish the program, you actually have to take an exam called NCLEX, which will allow you to actually to work as an RN. Each state has a different board and the requirements might be different if you're planning on coming to school here and then moving to another state. We're also accredited by the National League for Nursing, and Montgomery College is also accredited too. So you're coming from a school that's accredited and from a program that's accredited. Of course, there's different ways to teach how to be that hands-on clinician that we're talking about, right? So theory is where you get into the classroom, and I don't like using the word lecture anymore because we are a concept-based teaching school now. So you come in, we would give you like a voiceover of some of the activity to prepare you for class. And then you come to class and we want to see case studies and really and truly actively learning how to take care of that patient, which is then subsidized with your clinical experience, where your instructors are looking to match what you learned in theory in with real life patients. And then the second part of clinical stimulation, where maybe we can't find that exact patient we want you to learn about, or to supplement what you've learned about, you do it in simulation, which is a safe place to make mistakes. So talking about that, let's look into the future a little bit. And once you graduate, right, and you take your boards and you pass your boards, then you get accepted to a job. For the first year or so, you have what we call residency programs, where you work with a more experienced nurse. So you have a guiding hand to lead you on in your first year. And then after that year, you're expected to pick up the full load of a nurse, right? So let's talk about in the future. So let's come back a little bit and talk about how you get to the future. So those prerequisites I mentioned before, look at all the sciences here. Yeah, we're a pretty science-heavy degree. And even though it's an associate degree, we're getting you ready for that bachelor's, and I'll talk about that in a minute. So on the other side, you also need arts because we want a well-rounded person taking care of everybody. You have English and you have mathematics and a couple of humanities. And of course, you can choose these looking at the catalog. Okay, so let's take a look at the program. Your first semester, 4 courses, and this can be a little different from when you're taking your prerequisites because you have to take them all at the same time. At 113, our fundamental course is your heaviest course, and some of our students can talk to you about what that felt like transitioning from the prereq courses. Then in the second semester, we get pretty disease specific, looking at med surg, which is what we call anybody who comes in with diabetes or hypertension or an emergency of any kind. And then you have a specialty course, which is psych, which teaches you to really think and speak and communicate well with people who might have mental illness. Then during the summer, we have some extra goodies. You can do some more hands-on, which is nursing 120. And then if you have medic experience or you're an LPN, you can actually enter the program showing that you're qualified for the first 2 semesters and come into the 3rd semester. 3rd and 4th semester are progressing. So we're giving you those building blocks, right? Getting you stronger in the formation of nursing. So 3rd semester, 2 to 5, you have more chronic disease focus. While in 2 to 6, you're doing a specialty, OB and peds. So for this one specialty, you have 2 clinical days because they're 2 different populations we're looking at. The 4th semester, we're getting you ready for that acute, really ill patient in what we call 240. And then 205, we want you to know, we want to know that you know how to do a resume, that you can really and truly address documentation and work with interprofessionally with other healthcare providers. So once you graduated, unfortunately for nurses, that with your associate degree, that's just the first stop. With hospitals now demanding BSNs within 2 years, and actually it's a federal government thing. They give federal money to hospitals that have mostly RNs on staff, right? So listed here for you are the different schools that we have articulation programs with. So you go from RSN, registered nurse, to a BSN degree. University of Maryland, we actually have a dual degree, and I can answer questions about that dual degree with you. And just a little glance of what your expectations salary-wise would look like, right? So it depends on experience, and as you get more experience and it grows, your hourly pay will also grow. So bring the questions. Really interested in hearing what you have to say, and thank you.
Thank you very much. All right, I do want to give our student panelists a chance to tell us a little bit about their experience. So Kendall, tell me, what was your what's been the best part about being a student here at Montgomery College? How have you been helped in your goals professionally, career-wise? Tell us a little bit.
All right. Thanks for having me. Two big things that were really important were the labs for sure. I really enjoyed those, like Professor O talked about, very hands-on. So as soon as you're learning the concept, you're immediately applying it to the labs. And it also helps, I want to say, with the buy-in also. So when you're going out into the clinic, you can say, "Oh, we did this in the lab, and I enjoyed it, and it kind of helped me feel better." So that's also helping with buy-in. And then also that was something that was really helpful was just my classmates. We kind of just really stuck together the whole time, just sending little study notes, helping each other prepare for exams and quizzes and things like that kind of helped it go far, you know?
Grace, how about you? Tell us about your experience as a nursing student.
So going into this program, I really didn't know exactly what to expect. I was nervous. You hear all over the nursing programs are very hard, very rigorous, and that is the case. But I think what helped me a lot, especially at the beginning of the program, was like Kendall was mentioning, forming a group with very close people who all have the same goal. For nursing specifically, you kind of have to be very compassionate and very open and willing to help other people to go far in nursing. And I think the students and also the staff embodies that. It's a rigorous program, but the staff is there to help you 100% of the way. And Professor Agostini was my professor for our skills in 121, and we still maintained a great relationship. And I feel like you find that everywhere in the nursing program.
Excellent. Daniela, now you have a unique perspective being both a high school student and a college student, right? You're in dual enrollment program. So tell us what's been the best part about studying at Montgomery College?
The best part for me studying at Montgomery College was definitely the community that you build, not only with my fellow early college students, but also with the college student. You get to meet a diversity of students, different people from different backgrounds, people who have come in with different degrees, but we all are achieving the same goal of getting our nursing degree. So I think that's one of like the best parts of studying at Montgomery College, and also the staff that you work with, the professors really strive to prepare you for the real world. They'll answer your questions, they're there to help you, and they all want to see you succeed. So I think those two important factors of having a good student body community and a good staff community who are there to help you is really the best part of studying at MC for your nursing degree.
Awesome. Well, we will get to hear a little bit more from our nursing students in the upcoming Q&A. I do want to actually give an opportunity to our breakout Zoom hosts to just briefly tell us, what is your breakout Zoom going to be about? What programs are you going to talk about before we begin those shortly? So, Dr. Fuss, can you go ahead?
Thank you. I'm Tim Foose. I'm the chair of health sciences, and I'll be doing the health sciences allied health breakout session. So I've seen some comments in the chat, people asking about diagnostic medical sonography, radiologic technology. That will be in this one, as well as physical therapy assistant that you've already heard about, and surgical technology, health information management, and emergency management, fire science, homeland security. All those are under my area, and we'll discuss those in the Allied Health breakout session. Thanks.
Thank you. Morgan Key, can you tell us what will you be covering in your Zoom?
Yes, hello. I'm Morgan Key. I'm faculty. I originally came from the fire science and emergency services field. I'm currently, however, the interim manager for workforce development and continuing education, which is simply the umbrella that the college gives to all of our non-credit programs. So related to health sciences, I will talk about the American Heart Association CPR courses we offer, CNA, Certified Nursing Assistant, GNA, Geriatric Nursing Assistant, phlebotomy technician, pharmacy technician, medical assistant. And those are just the ones I planned to talk about, but I'm willing to address any of the ones that are in our Health Science Institute catalog.
Thank you. And finally, Beth Writings, let us know what you're going to discuss.
Hi, I'm Beth Ridings, and I'm the college-wide chair for Health Enhancement, Exercise Science, and Physical Education. So if you are interested in our behavioral health AA, the community health AA, the exercise science and physical education, the exercise science and/or the physical education programs, or finally our public health sciences program, then this is the breakout room that you want to join. Dr. Kilby will also be there to answer additional questions for you guys. Looking forward to seeing everyone.
Great. Well, with that, what I'm going to do is in the chat, you will see 3 different Zoom links that will take you to those breakout sessions. So if you click on any one of those, you can choose to leave this one and join this new one. If you want to continue talking about nursing, and if you have questions about nursing, we will continue discussing that. So you do not need to leave if your focus and your interest is nursing. And as we do that, actually a couple things. If you follow Montgomery College Television on Instagram, we have a couple of fun questions in our stories right now, so you can participate in that. It's MCTV Social on Instagram, and feel free to just take those fun poll quizzes. And for now, while we do this transition, we've got a nursing student story that we can share while we transition.
I spent the bulk of my life in South Africa, but once I got to Maryland and once I started actually studying at MC, with all of the support that I found here, it made me very determined to actually be encouraged to get to where I needed to be. While I was in South Africa, I wasn't quite sure what I wanted to do. I thought I wanted to go into the field of English. And then I decided to au pair. So I au paired in California for a year. I moved to China for a while and I taught English there. And then I was supposed to move back to California to au pair again with the family that I had previously. But the day before they could request a match, a family from Maryland requested an interview. And the moment we spoke to each other, we fell in love with each other. Since I've gotten to Maryland, I've been volunteering as an end-of-life specialist at hospices, and that made me want to go more into nursing. I did a few interviews at a few different schools, and the reason I went with MC was because I found that they had the best international policies, which I thought was great. The level of support that you find here, being a student at MC or working at MC, is amazing. The facilities that they have for the nursing program are amazing. They have so many things that make it seem like you're in an actual hospital setting, which is great, as well as all of the connections that they have with whether you want to transfer over to another institute or whether you want to go into the field. They have a lot of established connections with hospitals and things like that to help you. MC was very flexible for me because I was able to take quite a few of my prerequisite courses online, which helped me fit it into my schedule. So that did help a lot. They also have weekend classes that you can take. So I took a lot of my anatomy classes on a Saturday. So instead of having it like 2 or 3 times a week, you can just take it on a 1 day stretch. And that really helps. To students who are thinking about nursing, there's no question that it will be very challenging, regardless of which type of nursing you go into. The program itself it's a challenge, but it's definitely worthwhile. And yeah, I would just say once you set your mind on a goal, just reach out to all of the resources available because we have a bunch of resources available at the college. I know that advisors and tutors have been indispensable, so just make use of all of the resources that we have available. And if you even have an inkling of going into nursing, you should. It's a totally rewarding field to be in, and there's so many opportunities that you can go into.
All right. So I just want to make sure we are able to get into our Zooms. So we have, if you go in the chat, I am gonna paste the Zoom links again, and you'll see 3 Zoom links. The first one is for allied health. The second is for non-credit health sciences. And the third one is for health enhancement, exercise science, physical education, advanced personal trainer certificate, behavioral health, community health, exercise science, public health sciences. And any panelists who are... All right, give me 1 second. Well, while I continue to troubleshoot some things, I have a question that we want to address regarding nursing. So let's see. Okay. First of all, if there's a breakout Zoom for medical coding, which is that one? We've got, I believe that is allied health. So the Tim Fuss one. We also have a question from Ebony Huff. I am both Maryland licensed and nationally certified as pharmacy technician. I also went to Pharmacy Technician University, but I have been working in the field for 10 years. I'm looking for an associate's in health information. Is it possible for my experience to excel me in the program? For instance, skipping into the courses for health information. Any of our panelists who could answer that?
I think that'll be Tim Foos.
Is that right? Okay. So Ebony, and you know what? We are going to, let's see, one of the Zoom links, we're having a little trouble. So give us a moment, and in the meantime, if you have questions that you want to put in the chat, and any panelists who could assist with that. While we wait also, Grace and Daniela, can you talk to us a little bit about managing the workload? And what specific resources have been helpful to you while you've been studying at Montgomery College?
I would say it was difficult to adjust at first, for sure. There's a lot of different things coming your way. It's not just the material, it's the amount, and then also kind of learning, especially in first semester, how to answer the questions can be very difficult. I would say the best resources is the people around you and your professors. They want to see you succeed. They want to see you do well, and you should really lean into that because they can help you and push you through. And if you don't understand something or you're having trouble with a specific topic, they are more than willing to help. We want to foster safe, good practice nurses. So they're going to be your colleagues one day. And so I think just leaning into the people around you, going to skills lab has really helped me. It's different reading about skills and then actually getting to like do them and perform them. So that's what I would say helped me a lot.
And just to add on to what Grace was saying, the transition from regular college courses to nursing courses is a big jump because you're moving more from memory-based learning to more concept-based learning, in which you have to know the information that you're learning. You have to now be able to apply it to the questions, and all the questions that they give you on exams are NCLEX based questions, which will eventually help you on the NCLEX when you take it. For the workload itself, I would recommend setting up a schedule beforehand, whether it's you write it down physically on paper, have an online schedule, and manage your time really well, because that will help you so much more in nursing than trying to do it all at once. Definitely no procrastinating, getting all your work done early, and definitely using the professors and resources around you to help you manage the workload and to be able to understand the topics that you're learning.
Thank you all so much. All right, one more time. We have a new link for the session hosted by Beth Writings. And let me just show you real quick. So that session is covering health enhancement, exercise science, and physical education, as well as community health. So that is now in the chat. Sorry about that. And let us know if you're having any issues getting into that session. But that link is now again in the chat.
Hi, how are you?
Carolyn, can I address what it means to utilize your professors as a resource in nursing?
Yes, please.
Okay. So both Grace and Daniela discussed, using your resources. So your professors in nursing have 6 hours of office hours. And for the first 3 weeks, we sit and get work done. It's only until the first exam and people realize how different nursing exams are that people come in. And what I recommend, both Daniela and Grace mentioned that I was their professor. What I recommend is they come in and start, how can you help me learn this material inside me? Can you show me how I can do certain things? Can we go over what we did in class? So we're there to really and truly be an assistant to cover the information. Can we tell you what's on the exam? No. Do we give exam reviews prior to the exam? Nursing does not do that. But we will help you go through some of that material and understand it on a level where no matter what is thrown at you, you can answer it.
Great. We have a question. Is it possible to go for LPN in 6 months and then take the NCLEX?
So we are getting ready to put a new LPN program together. I don't think it's going to be in 6 months because it's still new and still in the works. If you take the LPN track, you'll be sitting what we call, not NCLEX, but I think it's LPN CLEX, right? It's specific to what you did. So you cannot go through LPN school and then sit to be an RN. It does not work like that. The material is different. Does that answer that question?
I hope so. All right. So is there, let's see, a breakout? Let's see. Guys, we have 38 questions, so we're doing our best here. I'm interested in lab technician training. Do you have that? I'm a phlebotomist.
Lab technician training, not in nursing. I'm trying to think if I can think of which health ally. I don't know if we carry that, but that would be a Tom Foose question, Dr. Foose's question, because he does all of health. He's in charge of all the health science.
Yeah. Here's one from Lauren. What specific math class is considered a prereq for nursing program?
So hang on a second. Let me pull up my advising sheet. But normally statistics, or if I remember correctly, is math 140. So it has to be above the basic. Ladies, can you help me out? Was it math 140? Am I correct? Can you remember?
I cannot remember. I'm being so honest. I have
That's all
no
right. Hang
idea.
on. I think I can pull it up because I was getting ready to do advising this week.
I think I took statistics,
It was
math
statistics, right?
117 or 121. I don't remember the number, but it was statistics I took.
Okay.
Hi, it's Maureen. Are you talking about college level math for nursing?
Yes.
It can be 117, it can be 120, it can be 165. There's many math classes. And even if you've been a student long ago, the numbers have changed. So you can email me and I can go over it.
Well, I think our advising sheet tells us exactly which one
117. Yeah, it probably says 117, which is statistics.
is, and I think it's statistics and there's another one, but I can't find it right now.
All right.
Okay.
Mary is asking, if I took a TEAS test back in February of 2022, do I have to retake the test? I already have a BS and just finished taking a general chemistry class.
So that's 2 years old. And if you look at your TEAS booklet instructions, they should tell you how long the test how long, it goes without expiring, for lack of a better word. And I'm not sure. Normally our students come to us with the TEAS already done. Maureen, do you have that information by any chance?
I absolutely do.
Excellent.
The scores expire after 2 years.
Okay.
And even though many people come here with advanced degrees, you still have to retake the test. Version 7 specifically. And we have TEAS people here. All you need to do is type TEAS in the search box of our website. And they're two staff that can assist with that. So the answer would be yes.
Yeah, unfortunately.
All right, so question that's more of a clarification. So is it 4 years nursing at MC, then 2 years in a 4-year university? What degree would it be after the total of 6 years of study?
Okay, so your prereqs can take you up to 2 years. The nursing program itself is 2 years. So that's probably 4. Some people do it in 3 if they fast track it, right? Once you get your associate degree, you can go on to any of the pathways I talked about. That can be done anything from 16 months to 2 years. Some people do it in 3 years, depends on family, workload, everything else. Some hospitals have a requirement that you have to have it done within 2 to 3 years. So it depends on where you end up also.
All right. Selena would like to ask a question audibly. So if you'd like, this is a good time to do it. I don't know if that's possible.
Audibly. Sure. How does that work?
Well, let's see. Well, we figure that out. Let's see. Some folks are having trouble joining the meeting with Morgan Key. I'm typing that link in the chat, and I'm gonna ask Jimmy to go ahead and try joining.
Alina, you can talk now.
Okay, Selena, yes, go ahead.
Yeah, thank you so much for the information session. I wanted to ask, I have a couple of questions. So if your prereqs is more than 5 years, what do you do? If your science prereqs is more than 5 years, what do you do for the nursing?
So Selena, I would say go see a counselor. Sometimes, depending on when it was taken, you can still use it. I'm kind of hesitant to say that because with sciences, the 5 years is the limit, right? So I would definitely say, please go see an MC counselor with that question.
Okay.
What's the other question you got for me, Selena?
Okay, and the other question is, if one is, I have the TEAS because someone had asked for 2 years. So if I have 1 year, one more year for my TEAS to expire, and I need to take some of the science classes, would it be possible to still gain admission and still be taking the prerequisite alongside? Is that possible?
So no, you have to finish all your prereqs, have your TEAS and everything ready, and then apply to the nursing program. Now, according to the new curriculum, like microbiology and a couple other classes you can take along with your nursing courses, but we really do not advise that because your nursing courses are so heavy.
Okay, so but then the microbiology and the chemistry, is it
We
something
don't
that
ask for chemistry. You'll be taking your chemistry on your pathway to your RN to your BSN.
Okay, so the microbiology is a required course for the nursing 2-year program?
It is.
Okay.
So I know they're going to put up the slides I went through really quickly, but take a look at the progression and the sciences that you need for the nursing program. Again, because of what you have going on with your science prereqs and they're about to expire, I would really, really ask you to take either Maureen has her information up for you, or go see a counselor, please, because we don't want you to expire and then have to start all over.
Okay. And also if one is enrolled in the program, what is the schedule like?
That's a great question. So what we try to do is have a specific day for all of our main courses. Now that might change in the future, right? So let me give you an example. Our fourth semester course is on Monday. Our first semester course is on Tuesday, but remember I told you in first semester you might be taking 4 classes. So the other 3 courses might be on another day. So we try to make it, and again, this might be changing because as logistics change and the program grows, we try to make it so that you're in school no more than maybe 3.5 days. So you have 1 day for the smaller courses, we call them, like the 121, 114, 129, and then you have another day for fundamentals, and then you have a clinical day. That doesn't mean that's done, because the rest of the days you're going to need to study. So that's why we really and truly ask you to look at employment and look at how heavily you're involved in other things when you're doing the nursing program. It's pretty intense. It's going to take up all your free time.
Okay. Thank you.
Thank you. So I'd like to move on to this question. How to become a travel nurse?
I did that for a little bit. So to travel, you really need and truly to finish the entire nursing program. Once you finish the entire nursing program, it's highly recommended that you have at least 2 to 3 years of experience, because once you travel, you don't get the same, what we call orientation program as a new nurse coming into that facility would. It's sort of abbreviated, because the idea is that you're so well versed in whatever specialty you're going into, you can quickly know the hospital and then get started taking care of patients safely. Right?
All right. So question about this. Are either of the nursing students working full-time while enrolled in the program? Grace, Daniela, would you like to take that?
I am not working full time. I am working part time 2 nights a week at the hospital as a CNA right now. I would say it's possible. It's possible, but it's definitely a challenge. I feel like you know yourself best. If you're able to manage your time and compartmentalize what you need to do, it's definitely very possible. I know they tell you absolutely not. They're all going to tell you that because it is very challenging to do both. It's challenging with just nursing by itself. I would say it has helped me personally just because I get to see some of the things at work that we learned about. And so that for me, I'm a very visual learner. So that's helped me to kind of put everything into perspective and to really understand the material. That being said, it does take a lot of time. You're not going to really have weekends. You're not really going to have a social life. So it just depends on, and I also don't have any kids. So it just depends on how much you're willing to give up and how much spare time that you have.
While we are on you, somebody is asking, what clinical rotations do nursing students typically enjoy during the program? I don't know if you've gotten to those yet, or Daniela, if you'd want to also take that as well.
Yeah, I can take that one. So normally the clinical rotations you have every semester, you're going to go somewhere. First semester, I think they take you to a nursing home, and then after that, you go to different hospitals and work on the floor, either alongside another nurse or working with your clinical professor. Personally, the ones I've enjoyed the most are in the med surg field. I wasn't too much of a pediatric or maternity nursing person. I enjoyed more of the med surgical ones. And as you go along in the program, the clinicals get more progressively harder and they start to you get to implement the skills that you've learned in school. First semester, you're implementing more bed baths, more CNA skills, while as in fourth semester, you're allowed to pass meds, hang IVs, assess a patient, and be able to implement more of those clinical skills that you learn along the program. It is enjoyable. Those are long days. I think they said it's about 10 hours of clinical from 6:30 to about 5 p.m. So you're there for a long period of time. But during that clinical period is where you really learn to be a nurse. That's where you're put in the position with a live patient and you're told to act as a nurse. So I think those are probably the most enjoyable part. And you also get to see the theory that you learn in class played out in the real world. So I think they're very enjoyable. And I think probably my favorite part as being a nursing student.
Excellent. Can you talk a little bit more about dual admission nursing program? How do you apply for it?
So this is only one. Who do you want me to talk?
Yeah, Michelle, go ahead.
This is only as I'm aware of, and this may change in the future, it's one school that we have a dual program with, and that's University of Maryland. So when you come in as a first semester student, within the first week or two, you're asked to meet with your advisor. So that advisor is going to be your advisor all the way through the program. You meet with your advisor at least 3 times a semester to see how you're progressing each semester. But that advisor would ask you if you're interested in an articulation program or dual program. This may mean some summer work because you might have to take classes like nutrition or other classes that are on an advising sheet that we have that we go through. You're also asked to speak to one of 3 professors that deal with the dual program and the articulation because they know the ins and outs of it. So your advisor is your first step. They will tell you who to speak to. And from there, both of you can investigate how this is going to work, what the workload will look like, and then we'll get you to that point. Does that make sense?
Great.
Daniela, either one of you in the dual program? No. Okay.
All right. So Isabella is asking, what does the first semester of the nursing program look like in terms of days and hours? Is there a variety of ways and options to put together a schedule? Maybe our students can speak to that.
I can speak to it. First semester, as far as I'm aware, and Professor Augustine, you can clarify, the schedule is chosen for you. You will get the CRNs for each class. I think you said that the fundamentals of nursing classes on a Tuesday, and then the other 2 supplemental classes for professionalism and communication and basic health assessment are on 2 different days. You get 1 day of no class, like a break period, and then 1 day is a clinical day. So I think about maybe 4 out of the 5 days you are in school and doing your learning, but I do not think you're able to choose your own schedule. It's chosen for you, and they will put it in a way that it will be beneficial to you and that you will be able to study and have breaks.
All right. Another question, what is the best advice for students coming straight out of high school and who want to stand out in as they apply to this program?
Okay, ladies.
I did not come straight out of high school, so I would say I like how NC does it, how they do it as a point system instead of just only taking one thing, whether that be the T's or your GPA, and just weighting that amongst others. So I think if you look at it as like every point matters, you do your best in the things that you can control, and you do the best you can. I think AT or the T's is a point, and then your GPA, if you're not the best standardized test taker, but you're a very good student, that'll show in your GPA. So I think that's going to help when people apply the point system.
I also kind of did a little bit differently. I didn't come straight out of high school. I was in high school when I started the program. So for me personally, I think if you do well on the T's and you have a good GPA, you kind of solidify your spot. I think those are like the main 2 things is a good GPA, a good college GPA, obviously from your prerequisite courses, a good GPA from high school, and then a good testing score from the T's, because those 3 things I think are the main things that the nursing program weighs in to determine whether they'll accept you into the program or not.
All right, so we're getting a lot of questions that I think are helpful with a counselor or advisor. And Maureen, thank you so much. You're doing a fantastic job answering some of these. We may not get to all the questions. So let me just work through some of these. All right. Can I complete my prerequisites at MC and then transfer to a nursing school?
Sure.
Easy. All right.
Yeah. I mean, some people want to go ahead and go straight to BSN program. That's fine.
Okay. I have a master's degree in quantitative field and would appreciate if you could speak more on the prereqs for transitioning to the ADN program. I'm really hoping I could get a specific list of prereqs.
So the specific list of prereqs were given to you in the slides, right? But I have a copy here so I can, of my slides. So give me 1 second. Let me just flip to that slide, right? So your sciences include principles of biology, which would be bio 150. And then your anatomy and physiology 1 and 2 are bio 212 and 213. Micro is bio 210. Psych 100. Sociology can be one of several sociologies. It could be 100, 105, or 240. And then your arts distribution. I can't answer, if you like to draw, drawing is fine, right? So you'll have to go to the catalog and the Montgomery College catalog and pick your arts distribution. Same thing for humanities. It could be a language, it could be in history that you enjoy. Your English is outlined for you. And we talked about math being 117, and I said statistics because that's the one I know when I advise, I look for. And that's it on my list of things that, according to our catalog, we need. I hope that helps.
Thank you. We have a number of folks who are foreign trained in their country. So can they bring their transcripts to be evaluated? Will they still have to take prerequisites here? General idea, how does that all work?
So I would advise anybody coming even from a different school, from a different state, to please have the registrar's office go over your transcript. They will know what's transferable and what's not transferable. At that point, once they tell you what's transferable or not, you may have to start from the beginning, right? What I want to tell you is starting from the beginning is not a punishment. It's actually getting you stronger and allowing you to focus on where you need to focus on to be the best nurse that you can be. I know that sounds very flowery and that's not what you want to hear sometimes, but different experiences at different times change as evidence-based practice and science changes.
Great. All right. Additional, let's see.
Caroline, if I can intercede, I know that people are
Yeah.
giving people my email to ask about the nursing program.
Yes.
Please do not email me. Please email the nursing program directly. All right, because with everything going on in classes, I will not be able to give you the in-depthness, if there's such a word, that you need to get what you need to do. So please do not email me directly. Please email the nursing program.
Thank you. Yes. And I'm also, we're showing here the contacts for, nursing chair and the other department chairs that you can reach out if you have questions, or if not, we could not get to all the questions tonight. We definitely want to point you to that. So in the last couple minutes we have, let's see, the students, I'd love to hear from you. How do you handle just your own mental health while working as a nursing student, or even just all the things I mean, it's a big load, right? Love to hear how you're managing that and what supports are there for you at Montgomery College.
I would say for me, running has really helped. Just in my free time, it's quick. It helps me to take a little bit of time and focus on myself. I personally made a very strong group of friends and study partners right at the beginning, which I was very lucky. I feel like a lot of people have found that in this program are all willing to help each other. So honestly, just being with them doesn't really feel like studying. You should find a group where you feel comfortable to make mistakes, feel comfortable to say the wrong answers and back up your wrong answers, because then that's how you learn. And I think integrating that kind of helps my mental health to have people that are going through the same things that you are. And like I said, just running, maybe just like reading a book, taking some time for yourself is still very important. It's sometimes tough to do, and sometimes we get very tunnel visioned. But I think we're learning to take care of other people, and we also need to apply that to ourselves as well.
Thank you so much. You know, we have ran out of time, and I want to be mindful of our time. So you can watch the replay of this on YouTube. You can also reach out to the contacts that we shared in the slide recently. And don't hesitate. You know, we are here for you. MC has plenty of resources and plenty of folks who want to help you. Thank you very much for joining us tonight. And don't forget to follow MCTV Social on Instagram. And yeah, stay connected with us. It was a great time with you all. Thank you so much for joining us.